Okay, so these are the categories, and I remember on your homework sheet, I gave you the name of the family and what drugs you have to know in that family. So the first group we're going to talk about are the phenothiazines. Now, there's more than just acepromazine in that family, but the main one that we use in anesthesia is just acepromazine. Some people say we're going to ace that patient. Promace are kind of, some, what it's known as. The reason we give this is a pre-anesthetic sedative. So this is a sedative, um, and it's going to decrease our general anesthetic. So if you have an animal that's pre-medded with ACE, it should decrease the overall need for induction agent, maintenance agent, should help them with recovery. It is best if it's combined with an opioid like a butorphanol. I mean, very rarely, and I am not a fan of using ACE by itself. The other thing, let me give you guys this tip. Whenever you use a drug and you look at the bottle, or not a lot of people do this, when you open a box, there's a package insert. And sometimes there's dosing on the bottle or on the package insert. And most of the time that dose is that drug by itself. The bottle dose of acepromazine is way too high, but it's not accounting for you giving it with any other drug. So that's why, we go in the Plum Drug Handbook, or you use your clinic protocol dose, because again, by itself, you have to use a lot of it, and it has some decent side effects. So it's really best. Our number one pre-med at Purdue, almost everything got ACE and morphine. Now, a lot of people use like dexdomitor and torb rather than ACE and torb. And some people don't like ACE. I love ACE used appropriately. It's a pretty reliable sedative. You can use it in horses, dogs, cats. It can be given IM and IV are the preferred routes, but you can also use this PO. And you can squirt it under the tongue, sublingual. It also comes in tablet form. So let me make a note about that. Sometimes now we have like trazodone and gabapentin and Soleo, but in my day, when dogs had storm anxiety or firework, they're scared of fireworks. At 4th of July, I used to tease my boss and say, can I just put acepromazine in the gum machine in the lobby so a client can put a quarter and get a handful, because I was filling it time and time and time again. So acepromazine is sent home a lot for anxiety reasons, storm, fireworks, car rides. But nowadays, they tend to use more like trazodone, Serenia, but acepromazine kind of used to be that. So when I say it can be given orally, now if you're going to give it for sedation for like surgery, we typically give it injectable. But again, if you can't handle them, you can squirt it in their mouth, or the owner can give a tablet at home so that it kicks in by the time you get to the clinic. Big key here, it is not reversible. When you give it, you are stuck with the effects. So it is not reversible. It does require also metabolism by the liver. So we need decent liver enzymes, and no matter what way you're going to give it. Let me talk about the effects. So it does have CNS effects. It should, cause this sedation / tranquilization. They won't move as much. They're not as interested in their environment. The key here also, no analgesic properties. So again, you could have a dog or a cat laying there super chill, and then you go to pull on a painful limb, and they might be able to tell you. They might be slower about it, but I've had animals look like they're dead asleep, whip up and try a bite. So when you're using this drug, if it's something painful, you definitely want to give an analgesic with it, because again, you can sedate them, but you're not treating the pain with this drug. It does have decent cardiovascular effects. The big thing is it is a vasodilator. So when you give a dose of acepromazine, the big effect that I'm cautious of, or why I try to use a low dose, is it's going to cause vasodilation, which could lead to hypotension. Or, anytime you make the vessel bigger, you decrease the pressure in that vessel. How much we do that is patient dependent. If the patient has if I'm worried about blood pressure in a patient, if the patient has questionable kidney function, I don't want to lower the blood pressure, which could affect the blood flow to the kidneys. So I'm really cautious about the hypotensive effects, which sometimes can lead to an increase in heart rate. So usually what should happen physiologically, when blood pressure goes down, a lot of times heart rate tries to increase to maintain blood pressure. So sometimes those are tied together. Acepromazine does not increase their heart rate. It's not the drug increasing their heart rate. It's usually an effect on blood pressure that sometimes causes that. And it can lead to hypothermia because anytime you vasodilate a patient, they're going to lose more heat. Now, some people on the test, if you said something about hypotension and vasodilation, some people are like, give a vasoconstrictor. But again, that's going to be, usually in this case, there's other ways we'll try to bring up the pressure and give them fluids, for example. I want to say one good thing, it does protect against arrhythmias. There is some anti-arrhythmic properties. So if you have an arrhythmic patient, there can be some indication to maybe use acepromazine. It does have that cardioprotective benefit, and it does decrease cardiac output. So, and cardiac output is how much blood is being pushed out of the left ventricle during systole. And now the decrease in cardiac output can be good or bad depending on the patient's condition, but it just happens. Now, the respiratory system, any sedative is going to depress respiratory function. I mean, they're going to breathe less often, and they're probably going to breathe less deep because they're sedated. So it's not known as a potent respiratory depressant per se, but it's going to enhance other drugs. So you're going to definitely get some respiratory depression. Usually it can be managed because we're going to be intubating the patient. We're going to have oxygen. So I don't worry a lot about this effect. It's just something to think about. It does, interestingly, have some antiemetic properties. People use, like I said, now you use Cerenia, but if you have a dog that pukes every time they go in the car, we used to give them ACE tablets, partly for sedation to calm them down, but also some anti-nausea. So sometimes it's a benefit to ACE in the pre-med. It's not a powerful antiemetic like Cerenia. Like, animals on Cerenia should not puke, like, bottom line. If a dog's puking on Cerenia, that's highly significant because it's very potent antiemetic. This is going to give you some protection. It's not to the level of Cerenia, but it is protective. It does prevent histamine release and allergic response. I put a little side note. I don't know how much you've talked about mast cell tumors in other classes, but a mast cell tumor, they're tiny little tumors, and sometimes boxers, pitties get them. I mean, any dog can get a mast cell tumor. But when you make them mad, like if you're trying to remove them during surgery, I was always very cautious when you clip a dog with a mast cell tumor. If you keep clipping over the tumor, you cause a massive histamine release, which is like a massive allergic reaction. Histamine granules mimic what's like an allergic reaction. And then what can happen is they get low blood pressure, all kinds of things. Like the fact that acepromazine has an antihistamine effect, it was kind of like our main pre-med if we had a mast cell tumor dog, because it could maybe help prevent antihistamine release. Now, those dogs always got Benadryl as part of their protocol. So all mast cell tumor dogs get Benadryl about an hour prior to surgery, just to hopefully, Benadryl's an antihistamine. But a lot of times we would add acepromazine as a pre-med. Now, if your dog comes in with an allergic reaction, they're not giving it ACE. They're going to get dexamethasone or Benadryl if they get stung by a bee or have a reaction to a vaccine. But If I'm expecting an allergic reaction, there could be a benefit. Remember, all I'm talking about these drugs is, if I have 3 drugs available and we're deciding which one to pick, if the dog fits in this category, this might be the drug that we go with. Now, definitely some adverse effects to be aware about. There's a lot under the box here, but it does reduce the seizure threshold. All that means is it makes it easier for that animal to have a seizure. So if you have an animal with a seizure history, we tend to not use acepromazine. This has had some controversy about it, but I've got other drugs I can use. I just, most doctors are like, why mess with it? Let's just pick another drug because of that. So the other thing about the CNS system is it can produce some, I'm normally giving this drug to calm them down, to sedate them. You can see excessive aggression or excitement. And let me explain why. It's kind of an interesting analogy, and I know that people maybe have had alcohol in here, maybe they haven't had alcohol yet, but let me give you a scenario. Sometimes people go into a bar and they see someone they want to talk to and they're nervous. They have some inhibitions, and then they have a few drinks. And then all of a sudden they're talking to everybody and everybody's cute and they're like, woohoo. What did the alcohol do? Alcohol took away your inhibition, right? You went in there apprehensive. And then after a few drinks, you're like, whoa. Now let me give you a dog. Dogs, I was told by a behaviorist once, I went to a talk and they're like, if a dog really wants to bite you, they will bite you. Sometimes people are like, ooh, that dog almost bit me, but I got away. And they're like, dogs have something called bite inhibition, where they get nervous and they act like they want to bite and they growl. You take a dog that's nervous aggression, and then you whop them with a dose of acepromazine. Well, what did that do? That just took away that dog's inhibition. That dog was reserved. And sometimes you'll have a dog that will act out because we've taken away their inhibition, and they could become more aggressive. Now, this isn't what normally happens, but again, there's good drunks and there's bad drunks, right? I mean, some people can drink and they're super happy. And sorry, if people are listening, I'm not trying to advocate alcohol, but it's a similar concept, is that some people, it can bring out their bad side when they drink, and sometimes people are super lovey. It's the same when we give a dog a sedative like acepromazine, is that sometimes the bad side of them is going to come out. So the reason I stress this, and I can't tell you enough how in clinics you are going to be the primary point of communication for client education. If I send this dog home on acepromazine, now this could be after a procedure, or this could be like firework anxiety, you send ACE home, because you guys will use potentially a lot of ACE for other reasons. If I send them home, I always tell them, especially if they have kids at home, I'm like, put them in a separate room, keep them in a dark area, don't interact with them, because what if the kid goes in to, pet Fluffy, and Fluffy's just not feeling, herself, and acts out at the kid. So, it's my job as a technician to explain to the owner, like, you might see you never think your own dog would bite you. And I don't think that would happen, but we have to be really cautious when we use this drug, and so when I'm around the animal, you can sometimes get these weird, side effects that I don't expect to see. And you just have to be aware of that. Cardiovascular and hypotension is dose dependent. The higher the dose you give, the more hypotension you are going to see. So it's going to really depend. One thing also, and let me say something about hypotension, okay? If you go to give acepromazine and you accidentally give double the amount, like you drew up the wrong amount, you forgot to get it checked, mistakes happen. It's not reversible. So you're going to be stuck with the side effects. And so what we're going to do in this patient is, well, I'm going to monitor sedation level. I'm going to monitor for hypotension. We're possibly going to give IV fluids to help maintain blood pressure support. Okay, so if you give it, you just have to be prepared for the potential. How do I support the patient now that I gave it? How do I help them now that we gave too much? Because again, you can't take it away. We just have to let it wear off and support the patient. Penile prolapse. Okay, so ACE causes nictitating membranes to stay prolapsed. So what happened, a nictitating membrane is a membrane that, will go back and forth. It will like kind of come out and go back, like the third eyelid. Sometimes when an animal's sedated, their third eyelid will kind of come up. Okay. It also causes prolapse of their third eyelid, meaning it comes out and it stays there. I had a lady call me, I'm not even kidding. We gave dog ACE, sent it home, fire, stuff like this. She calls and she's like, oh my God, my dog's dying. And we're like, wait, what do you mean? Your dog was fine. We gave you acepromazine. She's like, oh my God, he's laying there. His eyes are rolling in the back of his head. And she's like freaking out. Now this is pre-cell phone. Normally I'd be like, send me a picture. I talked her through checking heart rate. I talked her through checking respiration, gums, all of that was normal. But she's like, there's like this pink thing over his eye. I can't see his eye. So to her, it does look like his eyes are rolling in the back of his head. I have to be like, ma'am, and whoever sent this home didn't explain this to her. I'm like, the drug causes that eyelid to come up. That's normal. But if you can imagine, to an owner, she gives her dog this drug and she can't see his eyes, but she doesn't know. I know to expect that. She doesn't know to expect that. So, the thing we worry about horses and large animals, primarily stallions, because the penis in a horse is a nictitating membrane. It expands and retracts. If it can't go back in, it's going to dry out. And, if it's a stallion, especially a breeding stallion, we don't want to cause permanent damage where you couldn't use that stallion. So specifically in stallions, we watch acepromazine. It can drop a pack cell volume. So sometimes we give cats acepromazine as a sedative because they're mean to draw blood. But what ACE can do is it causes the spleen to enlarge. The spleen is like a sponge and it's a reservoir of red blood cells. So if the spleen enlarges and it sucks up a bunch of red blood cells from circulation, and then you run your PCV and it's low, it probably needs to be rechecked when the cat is off of acepromazine, just to make sure it's accurate, because it could just be the spleen just sucked up a bunch and the cat isn't truly anemic. Now, the antihistamine effect is good, except if you have an animal undergoing allergy testing. Now, I used to work in an animal dermatology clinic. They were sedated for their skin tests, but we never used acepromazine because when you do an allergy test, you need to see, histamine needs to be released so we see what they're allergic to. So you can see if I give an antihistamine and I do an allergy test, it's going to interfere. So that's just a little side note. Now, dose and needle placement, sometimes when we give it, you want to get a good muscle injection, because sometimes people are like, oh, ACE didn't work, but did we get a good stick, good muscle injection? Animals that we have to be cautious of, geriatrics and pediatrics. First of all, they have less muscle mass. Sometimes, a lot of times you can use ACE in a pediatric patient. Now, depending on how young, like there's neonate and pediatric, which, we usually say maybe 3-4 months old is where they start pediatric. Organs are still developing, so it can affect metabolism. Their blood work can be fine. It's just we tend to use a lower dose. Because remember, especially with this drug, I can always give more. I cannot take it away. So it's going to always be better to err on the side of a lower dose and then give more if it didn't work, and that's fine. Some dogs that are sensitive, you remember I talked about boxers, the English line of boxers we generally avoid. Giant breeds and Australian Shepherds, I haven't heard too much about that, but I generally, you know, if it's a big dog, I'm going to lower my dose, avoid it in a boxer, maybe avoid it in a greyhound. Collies are sensitive. And then, of course, cats and terriers, I tend to increase my dose. You know, terriers are just so full of energy. I might go on, you know, one thing to understand, and I don't typically have you guys memorize protocols and I don't have you memorize dosages because that's going to vary from practice to practice. I really just want you to understand the drug and what they do. But usually there's a range. Anytime you look up a drug, there's not just one dose for every patient. There's going to be a range, and we're going to have to decide where in that range are we going to start. You know, you have to just do your best guess. Physical exam, history of any illnesses, age, breed, procedure. Remember what I talked about? How do we pick a drug? And in these dogs, these situations, I'm going to probably go on my lower end of my range to be safe. Now, I will tell you, if you overdose, you treat the symptoms. So all of this, you know, monitor mentation, monitor blood pressure, monitor heart rate, make sure they're breathing okay, make sure they have good color. Nursing care is what you're going to do. Now, the maximum canine dose is usually 3 milligrams. So when you look up the dose and you calculate it, say for like a Great Dane, a lot of times you're going to be over this 3 milligrams, but that is kind of a maximum dosing. And I will tell you, it could be a 150-pound Great Dane and I worked on a 240-pound Mastiff, believe, like one of the biggest dogs. There took like 4 or 5 of us to put it on the table. Big old beast. That 3 milligrams is going to adequately sedate both of those dogs, even though there's a huge difference in their weight range. So I'm going to tell you, a lot of times you're going to calculate above this amount, but this was on our anesthetic sheet. Do not go above this many milligrams, because the bigger they are, the lower the metabolism. Now there are some notes underneath here that kind of get into the dosage, but again, I kind of want you to focus on the pros and the cons. And again, I'm mostly talking about you guys using this as an injectable, IM, sub-Q, or IM or IV. And remember, if you go IV, you're definitely going to be on your lower end because it's going to kick in. Do you have any questions about acepromazine? And I know I spent a fair amount of time talking about it, but it's a very common drug that's used for a lot of different reasons. And let me make one disclaimer. I said normally I don't give it by itself. I don't use ACE by itself if they're coming in for, say, like a surgery, because I usually want to give it with a sedative. But a lot of people use ACE in cats for grooming. You know, if a cat is aggressive, or say it's severely matted, and, you know, it's a lot easier to groom a cat that's sedated. And sometimes they'll use ACE by itself. In that scenario, you're not necessarily doing something painful. You just need the cat immobilized, or maybe you're just going to draw some blood or take an x-ray. Though there are a few scenarios where I could say ACE would be just used alone, but if it's an animal that's going to be going into, you know, a surgery or something's painful, you're better off mixing it with an opioid, buprenorphine, butorphanol, morphine, hydro, something like that. It's going to work better. Okay. So are there any questions about that? Okay, if there's no questions, I will go ahead and convert this and get it posted, and then we'll talk about the benzodiazepines tomorrow. You guys have a good rest of your day. Okay.
Bye.
Bye. Thank you.